Okay, thank you for this invitation. It's my first time virtually in Korea, so it's a pleasure to be there, and also very grateful for this invitation. So I will talk about this device, is Vitaflow Liberty. I would like to show one case. It's a case in a box, and also show to all of you what is the initial experience in Latin America with this device. So these are my potential conflicts of interest. And first, I would like to show the features, the characteristic of this device. This is a hybrid cell density frame with double layer PAT skewed for better sealing. And also the leaflets are bovine pericardium with anti-calcification treatment. So it's important to remark that in the outflow, there are low density cells. So this enables the deliverability and also the coaxial alignment. And in the inflow, this device has very high density cells. So it gives to the device very strong radial force that is very suitable for calcified anatomies or bicuspid anatomies. So this is the main characteristics. Also, the device has an inner and outer layer skid, double layer, so it mitigate the PVL. So this is the device itself. And also, these are all the size chart of the device. So you can treat annulus between 17 of diameter to 29. So there are very broad range of treatment for diameters, and also is suitable for valve valve in case of 21 Saber. So these are all the size chart that the patient that you can treat. In terms of the delivery system, the main characteristic, the main feature is that is the first motorized system that is recapturable. This allows to make a very precision implantation, very precise implantation. So to retrieve the valve, you can press one button with one-to-one instant response. It's very easy to use. For me, my personal impression is that this delivery system is very stable. It's more stable than other self-expandable device. So you choose the height of implantation, and the device will keep during all the implantation this height. And also it's 60 French equivalent because it has an integrated sheet as other self-expandable device. So I would like to show to you, all of you, one case to make an idea of what the device is and what it works. This is a male of 77 years old, body mass index of 24, with severe aortic stenosis, symptomatic for the dyspnea, New York Heart Association class 2, and also angina. Previous history, previous disease, CABG in 2004 with Lima to LAD, hypertension, dyslipidemia, diabetes, chronic renal failure in hemodialysis, 3 weeks, 3 times per week, BAH positive with undetectable load, chronic anemia. So it's a very, very healed patient, high risk patients, but the patient has not conduction abnormalities. The echocardiography shows a big gradient of 73 with velocity, max velocity in the aortic valve of 4.3. So this is the CT analysis with the annulus perimeter of 77. This fit for a 27 Vitaflow Liberty valve. The LVOT was very similar, 75 of perimeter. The coronary heights are high enough, so there are not any risk of coronary obstruction. Even the sinus of Valsalva are also big enough with average of 30. These are the vascular access. As you can see, very good vascular access, more than 9 millimeters. So this is the case. Usually, and this is for discussion, but usually we do all cases using CAS overlap technique to try to avoid conduction abnormalities using all valves, balloon expandable valves or self-expandable valves. But we see that using Vitaflow, if we do not use CAS overlap, the risk of pacemaker is higher. So we use with all cases, even Vitaflow cases, CAS overlap. So first we choose the position that we are going to use to implant the valve, and then we proceed. This balloon comes with the valve, is provided by MicroPort, and it's a very fast inflation and fast deflation balloon. In that case, we are using a pacemaker in the right ventricle, but we use predilatation with a 24 millimeters balloon using rapid pacing. This is very straightforward VAB. And you are going to see now the delivery system. This is the delivery system of Vitaflow. This button, the blue button, is to deliver the valve. Also, you have an on and off button, and this is a manual control in case that fails the battery. Never happened, but if the battery fails, you can deploy the valve manually. And this is the capsule. It's an ethanol capsule, but the nose cone of the valve is very soft. This is important to avoid any damage of the LVOT and the conduction system. It's very soft. This is the advance of the valve with the inline sheet. Also, the Vitaflow valve provides the wire. This is a pre-shaped wire that is provided also by Vitaflow. It's a good wire with high support. And you can see here the transition in the ascending aorta is very soft. In case that you have very angulated aorta, you can switch for another high support wire. And this is the implantation technique. Always in CAS overlap, we don't have to touch too much the wire. We start to push in the blue buttons if we are happy with the position to start the deployment of the valve. The delivery system comes with one black dot that marks the initial part of the valve, of the THV. So look here, the second operator is pressing the blue button and the valve is flowing 1-to-1. When we are happy, we push the button continually using wire pacing or rapid pacing, and this is a very easy deployment, okay? And also it's very stable. We use, I repeat, always CAS overlap and rapid pacing during the second part of the release. We are checking here the position of the valve in case that we have to recapture, but it looks very nice in CAS overlap and also in LAO projection. So this is what we see with this valve. No paravalvular leak at all, because the skirt really nice. Is the skirt is very fabulous, and also the radial force of the valve is very high. So usually we do not see any paravalvular leak. And also if we implant the valve in CAS overlap, the rate of conduction abnormalities is below 2 digits. So this is the retrieval of the nose cone. This is very similar to other self-expandable devices. Maybe the difference is that we have to recapture the capsule motorized, pressing this button, and this is the final result. No leak, no gradient. As you can see here, this case is edited, but it's like this. It's very easy to deploy. The results are like this, no leak, and for sure it's a device that it's very easy to use. And this is the control by transthoracic echo with no leak and also no gradient. So this is the case, and this is the initial experience in Argentina. This is the first Vitaflow that we did in August 2021. This was the classical one, not retrievable. And then we start in March 2022 with the Vitaflow Liberty, that is the resheathable one. And this is what we see. No conduction abnormalities, no PVL, no coronary occlusion, and extremely stable device. So we did initial experience with 28 cases, consecutive aortic stenosis patients treated with Vitaflow, and all cases were performed by the same proctoring team. The inclusion criteria was symptomatic severe aortic stenosis, and all patients were treated with Vitaflow and Vitaflow Liberty, and we use cast overlap technique in all patients. And this is our experience. The first 28 patients, the mean age was almost 80 years, 60%, 50% of male, STS score for 5.5, so moderate STS. As you can see, there are some bicuspid, not too much bicuspid as in Asia. We have less bicuspid than in Asia, 2%, and only one valve in valve, but very high CT Agatston score. And this was the procedural characteristics. All cases were done by transfemoral approach. We use Vitaflow and also Vitaflow Liberty in the same rate. We did predilatation in 93% of the patient, but the post-dilatation was very rare, only 70%. And the need for reposition of Vitaflow was only 28%, so it's very stable. And the short-term outcomes of 30 days are very nice. No poor position of valve embolization, no stroke, only one major bleeding on one major vascular complication, and new LVV 60%, but the need of pacemaker implantation using cast overlap technique was very low. So this is very, very good news, because the rate of pacemaker is almost the same of other valves. And also the mean gradient, the hemodynamics was perfect, 6.86 of mean gradient in average. The mortality was 0, and the hospitalization days was 2 days. So to finish, I would like to show to you the comparison that we did with our first Vitaflow experience with our last patients that we implant with Evolut. And as you can see here, if we compare, trying to put out the learning curve of the Vitaflow out of this evaluation, the need of pacemaker using cast overlap was the same, using Vitaflow and using Evolut. So it's not the device, it's the way that we use the device. Thank you for your attention.